colon cancer is on the rise. It's on the rise in young people, 18-year-olds, non-genetic. We want to say, oh, well, the younger generations that's getting it are the ones that had it genetic. No, I was 27 and I was not genetic. And every 18-year-old that I know that had it also did not have it genetic. So you want to know the symptoms of colon cancer? Let's talk.
Bite up. Bite up. Bite up. Yeah.
In this video, we're going to talk about colorectal cancer symptoms. It's on the rise in young people and what we can do about it. How do we screen? What are ways of screening? And what kind of doctors to talk to? If you're giggling at me saying the word rectal, you're going to keep giggling then, because this whole episode is going to be about poop and your colon and how thick your colon is, and you're going to really think it's funny. So buckle up. This is Kiva. Hello. Everybody say hi to Kiva. She has resting cat face, but she's not really cranky, I promise. Kiva will be joining us. She will not judge you when it comes to poop stuff, I promise. So colon cancer is on the rise in young people, and we don't know what that entails, right? It's a new thing for us young people, and we really are dialing in on what the symptoms are, when they're starting, how to look out for them. That way we can avoid having late stage colon cancer or colorectal cancer. And I had stage 3 colon cancer when I was 27 years old. I'm currently 31 and surviving and thriving. I have a platform in order to share my story and to share symptoms with you. That way you can look out for them. And I'm going to be telling you this from a patient advocate perspective. Keep in mind, I'm not a doctor. And if you have any questions for your doctor, go to them, okay? I'm here to just advocate for you and to give you more information. Number one symptom is bleeding. Rectal bleeding. And that means like a lot of bleeding. I mean, in some cases, in my case, I had a good amount of blood for a long time. And what I mean by that was sometimes instead of going to the bathroom, it would just be blood for months. So if that seems similar to you, then obviously that could be something. But a lot of times blood is overlooked for hemorrhoids. And hemorrhoids are also very, very common, extremely common. I'm obviously not a professional, but I think if you know your body best, and if you can't get rid of a hemorrhoid, then maybe go check it out and just dig a little further. So bleeding is never normal. And a lot of times doctors will always brush off blood if it's brightly colored, because dark blood will usually indicate something higher up in your GI tract. That means it's been digested, it's gone through the process a little bit, that blood's a little older. That's why it looks a little darker coming out. So a lot of times if doctors are looking for bright blood, they know that it's from local or the colon. And dark blood means it's passed through the intestines. So my situation in particular is I went to the doctor and they told me as long as you don't have dark blood, you're okay. It's a hemorrhoid. And now that colon cancer is on the rise in young people, that's a common misconception that we need to knock out the window. Knock it out. Because I feel like all blood, bright or not, coming from the rectum just needs to be looked at. Another thing about blood that doctors will tell you is if you are having blood when you wipe, that's usually a hemorrhoid, versus if you have blood that's on your stool or in the toilet, then that's enough blood to come with your poop and hang out in the toilet, then it's a good amount. Usually a hemorrhoid is like a vein, so when you push on it, blood will come out. That's why when you wipe, blood will come out. But so that hemorrhoid's not going away, mama. You go see that. You ask to go see the GI doctor, okay? You say, hey, doc, this hemorrhoid's been here for a hot minute. Can I see a doctor for it? And then that professional will tell you whether it's serious or not, okay? So bleeding. I know it's kind of scary, but I hope that helps. Feel free, if you have any questions, you are always welcome to reach out to me. Or feel free to put your questions down below. I know that this is really TMI, but whatever. Whatever. It shouldn't be TMI, okay? This is situations, real life situations we need to really talk about. So, like, really, really talk about them. The next symptom is going to be gas and bloating. This one, obviously, is because if you have a tumor somewhere in your colon, let me just hold up my cute little colon. If you have a tumor somewhere in your colon here, then gas isn't able to come out properly and it's building up from there up. So the bloating and the gas would be severe. And mine was horrendous, okay? Like mine was horrendous. But now that I have half a colon, it's still pretty bad. So, that's something that is really hard to kind of look at. But if it's consistent and you are really irritated by your gas and your bloating, you should probably see a GI anyways. So if you're uncomfortable about your gas and bloating, see a GI. Just period, whether it's, whether colon cancer is on the table or not. Number 3 is going to be abdominal cramping. Abdominal cramping is, honestly, I feel like abdominal cramping only happens when your tumor's like big enough late stage. So keep that in mind. A lot of these symptoms are going to be stage 3 and stage 4. So I was stage 3 and they told me I was lucky to even have abdominal cramping. And I had really bad abdominal cramping. They compared it to pregnancy pains and it went on for months. It did subside sometimes, but my abdominal cramping got worse after meals. And I'm assuming it's because my body is trying to push poop and food past a colon that wouldn't stretch and a tumor that it was so big I couldn't even get poop through it. So obviously the cramping would be bad. So keep that in mind. The tumor has to be pretty big, from my understanding, for abdominal cramping to be there. If you're having abdominal cramping and it's not related to, your feminine issues and you haven't gone to see a gynecologist or, anybody like that, I would definitely, recommend seeking out a GI if this is correlated to your meals at all. I would definitely always see a GI if you have any issues with this. They'll talk to you about the low FODMAP. They'll talk to you about a lot of things that you could probably do to live a way better life than you are doing right now. So feel free to do that. If you're in pain and discomfort for a while and this is a problem, then please go see a doctor. Another really big symptom of colorectal cancer is going to be anemia. Okay, I feel like I didn't know this was it, and I'm going to tell you a quick little story. I actually went to try to give blood before I was diagnosed, and I've never been anemic in my life. And I tried to give blood before I was diagnosed because it was like during the pandemic, and I obviously was, trying to donate blood. And they said my iron was so low, and it was such a shock. I went home and I was like, this is a big shock. Little did I know that it was a symptom of colorectal cancer. So don't overlook your anemia. Your anemia in your blood work is obviously showing something other than low iron. Sometimes it could show that there's bleeding in the body. Your body could be losing blood somewhere, AKA losing that blood in your stool. That's why your iron would be low, is if you have a lot of blood in your stool. And I was. So don't overlook that blood, literally. I overlooked it for so long. I literally was like, it's just a hemorrhoid. It could be, but talk to a doctor about it. The next symptoms are fatigue and unexpected weight loss. So I feel like fatigue is really hard to gauge, especially with females, because as you get older, or if you have an autoimmune disease, like I had Hashimoto's, I didn't really know, because you have a cycle, you really don't know. Like as a female, you just really don't know that any fatigue that you're having, just keep a little eye out for it. Okay, keep a look out at it. Just be like, hey, I'm going to keep an eye out for my fatigue. I don't think I have an autoimmune disease. Let me see why I'm so sleepy. I don't need to be a sleepy one all the time. And if you're a gentleman and you are obviously having fatigue and you don't understand why you're having fatigue, colorectal cancer obviously could be a sign of it. Yeah, for men, I think they obviously overlook fatigue too. They overlook blood. Men, I hate to speak for men, but a lot of times they're not usually looking at the toilet paper when they're wiping, so they're not seeing the blood. So just keep an eye out, okay? That, I would hate for that to be the reason why you're not noticing why there's blood in your stool. So yeah, if you're working a really busy job, it's probably really hard to track your fatigue, but really try to track your fatigue. That way, if your fatigue goes on for a long period of time, really make sure you bring it up to the doctor. If it is corresponding with other symptoms, then you probably should get it checked. Weight loss. Now, weight loss is a really big one, and I don't think you guys really understand how much like cancer really eats, and it doesn't have anything to do with you not eating necessarily, because for me, I was the size I am right now, and I had dropped about 50 pounds, and I feel like at least, I could be wrong. So for me, I dropped a lot of weight, and it wasn't like I was not eating. Like it will be a clear difference. Your weight difference will be pretty clear, I would say. But sometimes it's not. I think that's what's difficult, is that, like, especially since the colon is so big, some people's symptoms are different. So some may have fatigue and weight loss and blood, dark blood, light blood. Some may not. It is very difficult to pinpoint because the colon is so long and it's so thick. So make sure you are just knowing your body the best you can, making sure your stool's coming out in a full, proper manner. And I think that will help you along the way. Nausea and vomiting. So I actually had nausea and vomiting, but again, I think this symptom is relatively rare. Changes in bowel habits. If your changes in bowel habits go from, constipation to diarrhea to a stool, like to a really thin, they call it shoestring-like poops. Those shoestring-like stools literally look like shoestrings. Keep in mind, your colon is thick, right? Like she thick, she round. She is, if she's got like a full stool in there and she's packed to the brim, she should be thickums. So if she ain't thickums and she's as thin as your pinky, then if that's consistent, then maybe there is a tumor in there squishing the poop to be thin. So that's the logic on that. Oh, we've talked about all the scary symptoms. It's all really scary. I get it. Let's talk about what we can do about it, how we can kind of, chill back a little bit, not get overwhelmed about how it's on the rise in young people, and see how we can buckle up and lower the cases of colorectal cancer throughout the next generations. How we can do that. So the best way we could do that is talking to your doctor when you have any of these symptoms. As your patient advocate friend, I'm going to give you one piece of advice. If you claim to be like an IBS person, or if you're like, oh, I just have IBS or whatever, ha ha ha, it's cute, or hee, no. And you've never gotten a colonoscopy, or you've never talked to a doctor about it, then there's a problem, okay? Make sure you are if that's a consistent problem you're having, make sure you and your doctor know about that consistent problem, and all the other issues are checked off the list. So what do you do about all this? Go see a GI doctor, and a GI is going to determine what they should do to see what's happening inside your body. A lot of times your colon is so thick, like thickums, right? Keep in mind, your colon's got to keep your poop out of the inside of your body. And your poop is not good to touch the inside of your body. So your colon's got to be thick. So your colon is so thickums sometimes that not always a CT will see through. And that's why we have a colonoscopy. Colonscopy. That's all it is. It's literally what it sounds like, a colonoscope. A little camera that it goes inside your colon, and the doctor, your actual GI, will perform this. Like, your actual GI puts their actual eyes inside your colon, like with a camera. And it's really nice because very convenient, because if there is diverticuli or colitis or inflammation, there's a lot of things that could be going on in the colon before it is colon cancer. There's a lot of things, and sadly they all cause very similar things, but the only way to really see them is with a colonoscopy. So the colonoscopy checks for all of those things. Colonoscopy is the golden standard for detecting stage 1 colon cancer, stage 2 colon cancer, stage 3, and stage 4. A lot of times, if you have stage 1, stage 2 colon cancer, colorectal cancer, not always, but sometimes you can have that cancer just completely removed, and you can walk out that day and never go through chemo, radiation, and literally, that's it. They just removed it like it was a mole. Literally, that's how it is sometimes. So the goal is to really catch it when it gets to that point, so you aren't going through chemo and late stage cancer. If you can't get a colonoscopy, or sometimes, you don't want a colonoscopy. I'm rolling my eyes. If you could get one, if the doctor's offering it to you for a reason, obviously I would say take it. If the doctor's offering you other things, like the doctor's offering you Cologuard, which is like a little poop test, feel free to go ahead and do Cologuard. Cologuard is a poop test that you literally mail your poop off in a cute little box. And in a lab, they will test it, and they will also test it for blood, as well as tumor, like colon tumor markers that have come off from your tumor into your poop. I know that that's like the gross term, but from my understanding, that's what it's testing for. So a lot of times Cologuard is not always detecting a lot of cancer unless it's really late in the game. So you really want to, you really want to try to get a colonoscopy. But if you can't, obviously Cologuard is great to do. So there's also something called a fit test. A fit test they sell at pretty much every store. If you go into, the emergency room or anywhere very standard for testing, and if you say that you have blood, they'll usually give you a fit test. And that colorectal fit test is just detecting blood. So just blood. That could be hemorrhoid blood. That could be like colorectal cancer blood. We don't know. It just detects blood, which is great. We still need that test. So if you do have bleeding, sometimes you can't always see it. There is that fit test, which is really good to have. A lot of times, if you have detection of blood in your stool at all, like if your Cologuard comes back with blood in it, then you have to have a colonoscopy anyways. And like I said, colonoscopy is the gold standard, but GI doctors are a little overwhelmed right now. So things like Cologuard is really, really helpful. Nice to have things to help us as a society kind of bridge the gap between when we thought 50 was the time to start screening. Now we lowered it to 45, but now we have just a lot of people who it's just an average cancer now. It's not discriminated to or just isolated to the older group. Could be anybody, and we just don't know much about it yet. I hope I didn't scare you too much. I want you guys to think of this as a very logical thing, you know. Just keep an eye out for your poop. Make sure it's normal. And if it's consistently abnormal, then you probably have something going on or in pain. Then you should probably talk to a doctor about what's happening anyways. And if they think it's serious, then they will move forward with testing. And I think that that's the best thing that we can do as a society, is just take our gut a little more seriously than we did before. Instead of being like, oh, this is my fault, let me just like change my diet really quick. Yeah, it could be your diet, but also if it's consistent, add your doctor in the conversation, because they probably have information about something about your body that you just don't understand. And I think it's always worth adding more people into the mix. I hope that helps. And as always, it was wonderful being here with you. So I love that you guys are listening, and thank you again for listening. As always, stay out of trouble, but most importantly, stay beautiful. Bye. Y'all like feet too much. I gotta cover up my feet. Oh, I've learned that lesson on the other platforms. Theme song. Go ahead. Pop off, queen.